Hello, my name is Kelly Fischer, and I'm the Vice President of Wellness for Pathway to Living Communities. I'm happy to be here today to share some information about COVID-19 that can help us navigate through this holiday season. So let's just get started. Next slide, please. We want everyone to be COVID-19 safe. The pandemic is not going to be over anytime soon. So we need to really figure out how to have safe and happy holidays and joyful experiences, whether we're close together in the same room or seeing each other far apart, but using technology or just the good old fashioned phone call. There's no such thing as zero risk, but we're hoping that the information here will help minimize the risk to COVID-19. And it's also nice to just think, in fact, that we are Americans. Innovation is woven into our fabric. We can be innovative during this holiday season, and we can still have fun and joy, and we need to. It's important. I know people are decorating their homes differently, even though no one will be there to see it. But outside, maybe people can see as they drive by. So just consider how fortunate it is to be innovative and be in a country where you can do that. Next slide, please. So since it's not a normal holiday season and we do miss our loved ones, we have to really be thoughtful about who we're going to let into our community, our bubble, our pod, whatever you want to call it, and maybe to recognize the fact that it's better not to do that, that it's better and safer to do that next year for the holidays and not to put someone at risk. So we have a lot of ways that we can connect, and just think about that. I have an adult daughter that's in school in Alabama. She's not going to come home, but we are going to Zoom during our Thanksgiving dinner, and she can have the same fights with her brother and sister that she would if she was actually here. So we're all kind of excited. We're planning to have the same meal, even though we'll be in different states, and we're planning some fun activities that we can do together over Zoom. Next slide, please. And it's just as important to think about who not to have come into your home. All the links that you're seeing here can be found in the description for the video. So just know that we have a few sources, mostly from CDC, that you can go in and find a lot of information and help yourself. But you do need to consider, maybe I shouldn't have someone come to my home to keep me safe and my family safe and my bubble safe. So those links would help you figure that part out. We are definitely at an increased risk of severe illness if we are in the senior population, and that's the population we work with at Pathway. So we're hoping that our seniors all stay right where they are, and we are looking forward to exciting holiday times in each community at Pathway, making sure everybody has some fun. I did hear about some Macy Day parades that are going to be happening, and just lots of fun events throughout the holiday times for our seniors. Okay, next slide, please. This is a great video to demonstrate how quickly it spreads. It's very simple and fun. Let's get it rolling.
Justin had an awesome weekend. Now that it's Monday morning, he's taken the good vibes into the office and surprising his work pals with donuts. Problem is, tasty treats aren't the only thing he's about to share. Justin doesn't know it, but he picked up a germ at a concert last week. Now he's sprinkled his donut box, his hands, and the office door with those germs. In real time, as Justin says good morning to John, and Ashley grabs her favorite Boston cream, those germs have hitched a ride onto two new hosts. With a rub of the eyes and a gulp, they're through the human front door and ready to get down to the business of making people sick. A little later, George comes with the mail. Justin offers him a donut, and with a tickle in his throat, turns his head to cough. Justin says bye to George and leaves more germs behind. George starts making his deliveries, and as you can see, there's no return to sender on Justin's leave behind. All it takes is a touch of the germy mail, and then a touch of the mouth, nose, or eyes for a person to become infected. When it's time to call it a day, Ashley brings the infection onto the train. She hasn't washed her hands in hours. The germs covering them make a pit stop on the grab bar before finding a home on some new hands. A few cars over, Justin is coughing again. In these tight quarters, that's bad news. He and his fellow passengers get off the train and head to their homes. The spread continues. What if Justin's morning had gone more like this? A sneeze into the elbow, and then some hand sanitizer to be safe, a cough into a tissue, and a good job throwing it away and washing hands. Coworkers don't touch their eyes, noses, or mouths, no matter what. By following those steps, Justin's germs could have stayed away and slowed the pace of the spread.
So that was a great short video to really demonstrate how quickly COVID can spread and other germs. It's not just COVID. So that was great. Let's go to the next slide. These are the primary symptoms related to COVID-19. They're very similar to flu, so it's very hard for you to know. Maybe the one thing that's really uniquely different is the loss of sense of taste. So that if you, and smell really, if you opened up a bleach bottle and you weren't able to smell it, then you know that you've lost that sense of taste and smell, and you might be exposed to COVID-19. And we've had some team members who've had that happen to them. But they are mild symptoms. They're very difficult to assess, but keeping an eye on it for yourself, how am I feeling every day, and making sure you're taking good care of yourself is important so that you can know if there's a difference and seek medical help if needed. Okay, we're going to go to the next slide, please. It's important during the holiday season to think about your bubbles or pods, whatever you want to call them. We call them bubbles for the most part. Setting up a small group of family or friends that you feel safe with, that are following the same rules, making sure that everybody's considering risk factors before they get together, if you're from two different households. And you want to really avoid large numbers of people in general, because the more that you open up your bubble, the more exposure risk there is. And we want to reduce the exposure and reduce the spread. So CDC has created what they call a pod agreement. It's like a bubble pod agreement. And I know that my family has used that with their friends, and it's really been helpful for them because they had great base ideas for what you should do, and then they built on it. And so they have their little safe bubbles of what they do before they get together with anyone. So next slide, please. It's also important to get tested, and that's something we've done very well here at Pathway to Living Communities. We've done over 30,000 tests so far to really help identify asymptomatic carriers. This video that we're going to watch has a little bit of information about what these tests are, and I think it would be helpful for you to know. Let's play the video.
Hello, I'm Dr. Michael Pekicaro from Rochester, New York, where I'm a specialist in respiratory infections. Testing is important because we're trying to triage cases.
It's very important to understand who is ill and who is not. If we don't have access to proper testing, the truth is we don't know how to properly treat, diagnose, or screen the patients that we're dealing with at the front line. It creates a lot of anxiety, concern, and uncertainty about where things are going and how we're going to be able to treat them to make them get better.
There are three types of tests: the PCR test, the antigen test, and the blood test or serology test. The PCR test, that's where you take a nasal swab deep into the nose or the throat, and then you process looking for a molecular evidence. PCR test is best before you even have symptoms, you can detect the virus with PCR, and it's still there and easily detectable in the first week to 10 days of the illness. That's test number one. Antigen test, also nose, swab, or throat. There you're looking for the coding of the virus as being detected by a laboratory test. By 2 weeks into the illness, the PCR test is going down. The antigen test is really not reliable until you start to have symptoms. And by the third or fourth or fifth day, as the symptoms are going up, that's when the antigen test really works best. And the third test, serology test, or blood test, this is looking for immunity to the virus. It takes about 10 days for your body to make the first response of immunity that we can detect in your blood. And that's called the IgM test. And then about 2 weeks or 3 weeks later, we can detect it even better with another serology test called IgG. IgM is the first antibody response. We normally can detect that somewhere between 10 and 14 days after the onset of an infection. So the next window of time we look at is maybe around day 21 to day 30. Now the IgG is much higher than the IgM. At that point, you probably won't detect any IgM, but you'll see a sky-high IgG level that tells you, okay, the maximum immunity response has now been measured.
Generally, when you build up an antibody resistance, it means that you are protected from getting the worst case scenario of that illness again.
For the PCR test, doctors cannot do that in their office. It has to go to a hospital or to a laboratory. Whereas the antigen test and the serology test, those tests may be possible in a doctor's office or in an emergency room or urgent care setting. However, be careful. As these tests become available, you want to have something that is FDA approved or has been approved under an Emergency Authorization Act or some type of a waiver.
The most important thing for us is accurate, reliable, and factual data.
We're anxious too, but we're doing our job.
If we didn't have nurses and doctors on the front line, if they were too scared to go to work, this crisis would be 100 times worse.
We want to know if we've contracted the virus so that we can then avoid giving care and being contagious to others. And if we do become immune, we want to know that we're immune and we can return to work and we will be able to provide care over the long term.
Today's times are unlike anything I've ever seen in healthcare in my tenure, and I am concerned that until we accurately diagnose and test the significant number of cases that we're seeing in the United States today, we're going to have a significant struggle to be able to support those who are currently on the front lines.
For right now, what we want to do is make sure that our essential providers, healthcare workers, firemen, policemen, those first responders, that we're giving them the support and access to testing that they need for themselves in order to provide protection to the public. We also will be giving that information to our local hospital epidemiologists so we can track this pandemic across the United States.
So Pathway to Living Communities started testing early on in April, the middle of April, and it's been very helpful for us, especially because of the high number of asymptomatic people who just don't have any clue that they were exposed to COVID-19. So we're very happy about that. And we've learned a lot from those tests. We've done over 30,000 tests so far. Immunity right now, science has shared with us, it doesn't really extend very far. They thought that it was, they were hopeful that it was, but again, it's a new virus. And these tests are new. They're not 100% accurate, but they're getting better each time they develop a test. So that's helpful. But immunity doesn't seem to be something that we develop without a vaccination. So our best offense until we get that vaccination is going to be using hand washing, wearing a mask, and social distancing. And then once we get the vaccination, we can feel a lot better. That's probably not going to happen until the spring. Next slide, please. I love this video that we're going to watch because it's very simple. We don't even think about these things. In my home, I live alone, and yet I still wipe down the doorknobs. I wipe our front entrance off in this apartment building. I spray Lysol and disinfectant around just to make sure that it's safe. I do go out into communities, so I know that as a healthcare provider, I may bring something home without realizing it, or even if I just run out to a store, there's a risk. But if you're doing these things every day in your home, simple wipe downs, you'll keep the mitigation or the risk of getting COVID much lower for your family and loved ones. Let's watch this video.
Remember to sanitize high-touch surfaces every day. Use a disinfectant wipe or clean cloth with at least 70% isopropyl alcohol on work badges, credit cards, purses and handbags, wallets, game controllers, remote controls, light switches and switch plates, doors and doorknobs, staircase railings, vehicle door handles, vehicle interior. And don't forget, practicing proper hygiene helps keep you, your family, and your community safe.
Don't forget to add in your refrigerator handles and your stove and microwave, because that's where we all go to the most, right? While we're at home. I'll share also, I carry around my spray sanitizer. I have it in my car. If I get to go to a rooftop yoga class, I'm able to spray my own mat, which I bring with me to that class. And I also carry around my hand sanitizer. So you should all have small hand sanitizer packets in your available to you, so that you can use it easily in your car or wherever you are outside. You just want to make it easy and simple. Okay, next slide, please.
Remember to sanitize.
So sometimes we are going to have people that will come from out of town, even though it may not be the best choice. For whatever reason, we will have some people traveling during the holiday season. You want to know that driving is safer than flying, because it's a limited bubble, right? You're in the car and you can control that. And you know who's in the car, if it's just you or someone else. On a plane, you don't really know who's with you. However, if you're wearing a mask and you're following all the protocols of social distancing, that will help. The air exchange on planes actually are very good. They have the same HEPA filtration system as surgical operating rooms do. So we know that that air exchange is very good. It's just that you don't know much about the person that you might be very close to during that flight or online while you're getting ready to go on the plane. Many airlines are now starting testing, which I think is fantastic, and that's going to help. Because again, we're going to be going through this through the winter and into the spring. You also want to ask whoever's coming to your home to consider following that pod type of agreement for 10 to 14 days before arriving, making sure they're having the least exposure, and that they consider getting a test 3 to 5 days, a PCR test, before they arrive as well. That's it for this slide. Again, CDC has great travel information. Then the next thing, you're there, the holiday is here. Can you have it outside, inside? That's really the question. If it's possible to be outside, that's better for you. So for my family, we do follow the pod agreement, the bubble agreement. We're all locked down for 2 weeks before we get together. We all get tested 3 to 5 days before we come together. And everyone is following very high precautions. But we also like to be outside, and I have a neighbor that's in healthcare as well, and they want to celebrate Thanksgiving with us. So we're looking at doing our desserts, that traditional pie, outside, if it's safe, if the weather is nice, if the weather permits. If it doesn't, then we just won't be able to do it this year. Again, lots of good information with CDC. Next slide, please. Soap versus sanitizer. This is a great video because I will share with you, as COVID has changed the way we live, it's also helped us improve hygiene just in general, just the extra hand washing, extra protection. So let's watch this slide and see what you can learn from this.
Your hands up close are anything but smooth. With peaks and valleys, folds and rifts, there are plenty of hiding places for a virus to stick. If you then touch your face, the virus can infect you. But there are two extraordinarily simple ways you can keep that from happening: soap and water and hand sanitizer. So, which is better? The coronavirus that causes COVID-19 is one of many viruses whose protective outer surface is made of a lipid bilayer. These lipids are pin-shaped molecules whose heads are attracted to water and tails are repulsed by it. So, in water-rich environments, lipids naturally form a shell like this, with the heads outside and the tails inside. Their shared reaction to water makes the lipids stick loosely together. This is called the hydrophobic effect. This outer structure helps the molecular machinery of the virus break through cellular membranes and hijack our cells. But it has thousands upon thousands of weak points where the right molecules could pry it apart. And this is where soap comes in. A single drop of any brand of soap contains quadrillions of molecules called amphiphiles, which resemble biological lipids. Their tails, which are similarly repulsed by water, compete for space with the lipids that make up the virus's shell. But they're just different enough to break up the regularity of the virus's membrane, making the whole thing come crashing down. Those amphiphiles then form bubbles of their own around particles including the virus's RNA and proteins. Apply water and you'll wash that whole bubble away. Hand sanitizers work less like a crowbar and more like an earthquake. When you surround a coronavirus with water, the hydrophobic effect gives the bonds within the membrane their strength. That same effect also holds the big proteins that form coronavirus's spikes in place and in the shape that enables them to infect your cells. If you dry the virus out in air, it keeps its stability, but now surround it with a high concentration of an alcohol, like the ethanol or isopropanol found in most hand sanitizers. This makes the hydrophobic effect disappear and gives the molecules room to move around. The overall effect is like removing all of the nails and mortar from a house and then hitting it with an earthquake. The cell's membrane collapses and those spike proteins crumble. In either method, the actual process of destroying the virus happens in just a second or two, but doctors recommend at least 20 seconds of hand washing because of the intricate landscape that is your hand. Soap and sanitizer need to get everywhere, including your palms, fingertips, the outsides of your hands, and between your fingers to protect you properly. And when it comes to a coronavirus outbreak, doctors recommend washing your hands with soap and water whenever possible. Even though both approaches are similarly effective at killing the virus, soap and water has two benefits. First, it washes away any dirt which could otherwise hide virus particles. But more importantly, it's simply easier to fully cover your hands with soap and water for 20 seconds. Of course, hand sanitizer is more convenient to use on the go. In the absence of a sink, use the sanitizer as thoroughly as possible and rub your hands together until they're dry. Unfortunately, there are billions of people who don't have access to clean drinking water, which is a huge problem at any time, but especially during an outbreak. Researchers and aid groups are working to provide solutions for these communities. One example is a device that uses salt, water, and a car battery to make chlorinated water that kills harmful pathogens and is safe for hand washing. So wherever possible, soap and water are recommended for a coronavirus. But does that mean it's best for every viral outbreak? Not necessarily. Many common colds are caused by rhinoviruses that have a geometric protein structure called a capsid instead of a lipid membrane. The capsid doesn't have nearly as many weak points where soap amphiphiles can pry it apart, so it takes longer for soap to be effective. However, some of its surface proteins are still vulnerable to the destabilizing effect of hand sanitizer. In this and similar cases, hand sanitizer may be more effective, especially if you then wash your hands to remove residual particles. The best way to know which to use for any given outbreak is to do what's best for all things illness related. Follow the advice of accredited medical professionals. Need help timing 20 seconds of hand washing? Start now. Wow, nice clean hands you have. Oops, don't touch your face. You look well rested. Have you been stretching? Must be all that water you're drinking. Happy birthday to, I don't think we have the copyright on that. Well, happy birthday. I forget the words.
So that was an easy, fun, informative video, and I hope you enjoy that and really see the importance of hand washing. You may want to remind everyone during a holiday celebration or even just a few days of having your bubble expanded with others to wash their hands every 2 hours. Just have somebody take charge of an alert like it's time, set your phone alarm on, and just wash your hands frequently throughout the day. It will keep everyone healthier and safer. Next slide, please. So the next thing we are asking everyone to do, and very much at Pathway to Living, is just mask up. Enjoy that you can have some variety and styles out there. A lot of companies are making really good masks. If you want to make your own, the CDC has a link for that as well. But please wear a mask. We know that it enters our body through our nose and mouths. We can reduce COVID if we just block it from getting out into the air. So please wear your mask as much as possible. And if you have new people in your bubble, in your home, don't feel funny about wearing a mask while you're at home. Keep your family and your loved ones safe. Next slide, please. This is also a very good informative tip on reducing exposure when you go food shopping, because we're going to do that for the holidays, whether you have any other members coming to your bubble or not. Let's get this slide going, this video.
We're here today to do a fun experiment where we show how easy it is to spread germs. We're going to demonstrate this using a powder that glows underneath a black light. As you can see, the only item in our experiment that has been contaminated with powder is the water bottle. In this experiment, the powder represents our bacteria, our germs, and viruses. So we can demonstrate how easy it is to spread this, even if we're running into the grocery store with proper PPE and protective equipment and grabbing one item. Okay, I have placed my protective equipment on correctly, and now I'm going to run in and buy some water at the grocery store. So here's my water. Beep. I'm going to take my pen and pay for it. I got my receipt. Sign for that. Thank you. Open this up, get a drink. I've been shopping. Spread this out. Okay, so I've gone out to my car and I am ready to take off my mask and gloves. And I want to show you how important it is that we do this in the right order, in the right way. So let's see how I did. I'm going to turn on my black light here. Oh my goodness. So starting off, we knew it was on the one surface. Look at my gloves, my mask. Right here on the outside of my gloves, the receipt. Oh my goodness, look at this pen. The poor person who uses this pen after me. Oh, and look at my hands. Oh my goodness, the worst part about this is when I remove my mask, I did not use the proper procedure, which means that that must be on my face too. COVID-19 spreads through getting in your nose and in your mouth. And now this is really close to my nose. But it doesn't have to be that way. I've been a nurse for 14 years, and I'd like to give you some tips and tricks for how to put on your personal protective equipment and take it off safely so that you don't have to be afraid to go to the grocery store. So let's talk about the cloth masks. It all starts with our hand hygiene. It's always all about hand hygiene. Either our alcohol foam hand sanitizer or good old soap and water. So we want to clean our hands before we put the mask on. Hand hygiene is the #1 way to prevent the spread of any infection. And that's true with COVID as well. So you want to let your hands dry if you've used hand sanitizer. And then you're going to start with your mask by holding it on the ear loops. And you're going to loop one ear first. And then wrap around to the other ear. And you want to make sure that the mask actually covers your nose and your chin and your mouth. If you have a metal piece in your nose, you want to make sure that it seals over the bridge of your nose. Those of you who wear glasses, this will also help prevent your glasses from getting foggy. You want to make sure that there's as good of a seal as possible around the edges of your face and underneath your chin so that nothing is getting up underneath there. Now let's talk about gloves. Since I haven't touched any other surfaces besides my mask, I don't need to wash my hands. But had I needed to touch something in between putting on my mask and my gloves, I would want to hand sanitize again. Now we can go about our business. All right, we are done with our shopping, and now we're getting ready to take off our personal protective equipment safely. So the very first thing you want to do is take off your gloves. These are dirty, so anything on my glove is dirty. So I want to keep glove to glove when I take off the first glove. I'm pinching it here, and I'm going to pull this off inside out and drop it into the trash. My hand is clean because I cleaned my hands and did proper hand hygiene before putting my gloves on. So I'm gonna skin to skin, put my fingers inside the glove on my skin, pulling these inside out as I go through, and then just dropping the rest of the glove inside the trash. Next, guess what? Hand hygiene. I'm gonna use some alcohol to clean my hands before I touch my face. So I've been out in public, and this has all been exposed to the public. So I want to start with one ear loop with my clean hands and remove one ear loop, and the other ear loop with my other hand. And I'm going to drop this in the trash or in a safe place. If you have a cloth mask and gloves, you can throw these immediately into the washer on the highest heat setting when you get home. These can also be dried in the dryer on the highest setting. Just keep in mind that the elastic might wear out over time. Or you can air dry them. You just want to make sure that they are completely dry before you use them again. After removing your gloves either into the trash or into the washer, next, guess what? We have hand hygiene. I'm using some alcohol foam here, but if you're at home, soap and water lathering up for 20 seconds is best. Now you know all our tips and tricks. Your safety is in your hands. Thank you for doing your part.
So she did a great job on giving us some tips, and I'm just going to share that there's something called SMS, and it's really the sliding mask syndrome. And that's when people slide their mask up over their head. They're wearing it as a hat, and then they're sliding it under their chin, or they're hanging it off an ear. If you just remember what she stated in her video, the outside of the mask has germs, so does the inside of the mask. And when you're sliding it, you're sliding those germs all over. And if you take off your mask and put it on a counter that has COVID on it at the store or at a restaurant, you're just picking it up and putting it right back into your face. So please, when you take your mask off, use the proper technique. Use the ear strings, whatever mask you're using, and then put the mask inside a paper bag. We use those at Pathway to Living, and it works beautifully. Just a simple brown paper bag. And then the other option would be to put it on a clean napkin or a clean tissue. Don't just put it on a counter and then pick it up and expose yourself to more germs. So that was a great slide. Let's go to the next one.
We're here to
So with the holidays, everyone that may or may not be coming, no matter who's in your bubble and your family, you also want to make sure that you establish your ground rules for what to do if somebody does become sick during the holiday season. Do you have a place to go get tested? That's easy. Do you have a 14-day isolation plan? Do you have plenty of disposable goods in your home, utensils and paper plates, so that you're just throwing things out? And how would you care for somebody in your home if they're infected? You want to make sure you're not sharing utensils, you're not sharing towels or same sleeping space. It may be, you have to be innovative, and we can be that, to figure out how to get a safe space for that infected person, and then continue to watch everyone else for exposure. And again, CDC has a lot of tips on how to do that. Next slide, please. So we at Pathway want to extend you the most wonderful, warmest, weirdest 2020 holiday season. Know that we're here to help you with as much information as we can. We're going to help our seniors celebrate every holiday, every moment as much as they can inside our communities, in our safe bubbles there, and enjoy every moment that we can. We have to do that. We all have to do that. We just want to do it safely and with the wisdom that we have from all the information we just shared. Thank you very much and have safe and happy holidays.